we take this off regardless if we're gonna put them on a mechanical vent, right? Because I can't put suction to this. So he comes off. So we're gonna get the right size Y that correlates with the actual tube that we have. So we're gonna be utilizing that same Y, even if when we do take the surfactant catheter out, we're gonna use the same Y for a real suction as well. So we of course want to keep this clean. We don't want it to hit the bed. We are introducing it into the patient, so we do not want it to be dirty, because then we can get VAPs and all that stuff. So we want to keep this in the packaging and just add it here. Now this side is for the surfactant catheter, of course, and this side is for the actual bagging of the patient. So from previous education, we know that we are to draw up initial dose, or loading dose is 2.5 mLs per kilo of CuroSurf. So the CuroSurf comes in a box like this, but pharmacy may or may not take it out of the box, and you may only have the vial. Is the vial in here? The vial is in there. Cool. So this vial, obviously it's expired, but you would be looking for a nice white, milky type of substance. Now we have to remember, it's gonna look like this. It'll be nice and white. We do not vigorously shake it. We're going to slowly turn it, swirl it around. If you do feel the need to have to shake it, we're gonna do slow and steady mixing action. That is because it does have some sediment towards the bottom if it's left there for a while. So we do want to make sure that the mixture is completely mixed up. But just remember, key thing, do not shake it vigorously because it will cause frothing and it could plug your tube. So it does have the protective cap. Then we end up with this rubber stopper. So with the rubber stopper, this one is missing the metal piece that protects it, that keeps the stopper in, but we need to take that metal piece off with hemostats, or if you pop your plastic off appropriately, it actually leaves a little metal piece up a little. So we take that metal piece off because the end goal is to remove the entire stopper. The reason for that is this large bore needle has a pretty big orifice there. So what can happen, has not happened here or anywhere that I specifically know, but what can happen is that large bore, as we pierce the rubber, a piece of the rubber can end up inside of the needle, and you could potentially be giving a piece of rubber in with the surfactant. So that's the main reason why we remove the entire stopper and aspirate the entire contents that are in here. So that is important when picking which vial as well. So we have 3 ml vials and we have 1.5 ml vials. So if we're going to be giving the loading dose to a 1 kilo kid, he automatically is going to get 2.5 mLs. So we would pick 1 3 ml vial. Of course, if you only have 1.5 vials available, then we would pick 2 1.5 vials available. So we're gonna empty out the entire contents, because for infection purposes, you don't wanna continue introducing more and more needles into the vial. This is sterile, so we wanna keep it sterile as well. So with the large bore needle, we're going to introduce it into the vial and aspirate the entire contents. There may be a little extra, so even though this is a 3 ml vial, you may get about 3.2, 3.3, but that's okay. Just take it all out. So we will pretend that like we completely aspirated the entire 3 mLs here.